Hello, everyone, and welcome to today's webinar on improving lung health through the future of the European health data space. My name is Dave Keating. I'm a journalist based in Brussels, and I'm going to be guiding us through today's conversation. Now, today's event is going to bring together digital health actors to discuss how the expectations from the respiratory community could be reflected in the future EHDS legislation, and whether EHDS has the potential to improve prevention, diagnosis, management, and quality of life for people living with lung diseases. The EHDS is a regulation that aims to provide a common European framework to promote better exchange and access to different types of health data, like electronic health records, genomics data, data from patient registries, etc. Now, this is not only to support healthcare delivery, the primary use of data, but also for health research and health policymaking purposes, the so-called secondary use of data. Now, at today's event, we are launching the European Lung Health Group's policy briefing, which is the same name as the title, Improving Lung Health Through the Future European Health Data Space. That is now live, and that's going to form a big basis for today's discussion. Now, you guys will be able to join in the conversation. We encourage you to use the social media hashtag #BreatheVision. And you're going to be able to ask your questions to the panelists. You're going to be able to do that by using the Q&A feature here in Zoom. It's the bottom right button on your screen. If you already know what questions you'd like to ask the panelists, you can go ahead and type those in now, and I'll be reading those out to the panelists at the end of the event. We're going to have the panel section first. After we have an introduction from our MEP host, we're going to have a panel discussion. Then I'm going to ask the panelists a couple questions, and you guys will be able to ask your questions later on. Please keep questions in the Q&A and comments in the chat. So if you have a comment, an interesting link for the other viewers, put those in the chat, and a question that you'd like me to read out, put those in the Q&A. We're going to be formulating our discussion around the four main sections of the policy brief, which is how EHDS can facilitate virtual and in-person care, how it can facilitate increase access to quality care, how it can help with transparency and foster participation, and how the health data space can enable effective research on respiratory disease. Now, we have a lot of interest in today's event. At last check, I saw that we had 324 people registered for the event. I think it's gone up even higher since then. So I can tell this is really, really a big area of interest. And of course, I think that has a lot to do with the fact that healthcare and health preparedness is at the top of everyone's mind right now because of the pandemic we're all living through. So we're going to start off today with some opening remarks from center-left Portuguese member of the European Parliament, Sarah Cerdas. Now, in addition to being an MEP since July 2019, Sarah Cerdas is also a medical doctor. She's a member of the Committee on the Environment, Public Health and Food Safety in the European Parliament, and is also a member of the MEP Lung Health Group, and also in the interest group on allergy and asthma. MEP Cerdas, I hand the floor over to you.
Thank you, David. Good afternoon, everyone. Glad to see so many people joining us from all across the globe. So greetings from Brussels and welcome to this MEP Lung Health Group event on improving lung health through the future of European health data space. The creation of this European health data space is one of the priorities of the current Commission, and it's something that the European Parliament has been very vocal about. This health data space is set to promote safe exchange of patients' data, including when they travel abroad, and citizens' control over their own health data as we build the e-health digital service infrastructure. It also aims to support research on treatments, medicines, medical devices, and outcomes, as we will have more data in order to have more information. We'll have also to encourage the access to and the use of this health data for better research, better policy making and regulation with a trusted governance framework and upholding data protection rules. As you can understand, this is a very important topic here for the European Parliament. Also, it will aim to support digital health services and clarify on the safety and liability of AI and artificial intelligence in health. We know now that healthcare sector is going, it's not only this sector, but specifically on healthcare, there's a key area where important digital changes are already happening and many more are yet to come. And with this European health data space, disease prevention must be one of our main priorities. And this includes, for instance, empowering citizens in relation to their health with user-centered and personalized services. We also aim to build a high-security cross-border health data exchange for research and health policy. This will improve prevention, diagnosis, and treatment of diseases, such as with the sharing of electronic health data records, genomics data, data from patients' registries, among many others. And this will also aim to improve the complementarity of member states' health services and supporting and enabling research and development in the field of mHealth in Europe. When specifically focusing on respiratory diseases, it is paramount to explore digital tools for remote disease management and self-management of certain diseases and symptoms in order to reduce the administrative burden of health professionals and promoting patients' autonomy. It is very important to also note that, as stated in Article 20 of GDPR regulation, it is very important that this data system is built on transparent foundations that fully protect citizens' data. With the EU citizens' trust in the safety and confidentiality of their sensitive data. And recent data also shows, and I would like to just share a few brief figures with you, that 90% of EU citizens agree to access their own health data, 80% agree to share their health data if privacy and security concerns are assured, and 80% agree to provide feedback on quality of treatments. So this is an unbelievable time to be here and legislating on these improvements. With the emergence of new technologies, there also comes great challenges, but also opportunities for development of better provision of healthcare. It's just to finalize, I would like to highlight that it's essential to acknowledge that people along lower social gradients will be more vulnerable to becoming excluded by the digitalization of healthcare. So it is very important to target and empower vulnerable populations as well, and ensure that no one is left behind with this transition. So I would like just to finalize, thanking you again for the invitation, for the opportunity of opening this event, and wish you a very productive discussion.
Thank you very much, Sarah Serdash, for those inspiring opening words for us to start our discussion with today. So I'd like to get a sense of how you all in the audience are thinking about these issues before we start our panel discussion. So we're going to have a quick poll question for all of you. So if we can pull that poll question up now, it should have just popped up on your screens. The question is, what do you consider the most important objective for European health data space to benefit lung health? Your options are advance prevention and public health, improve care with in-person and digital care or treatment, improve patients' control over disease, like with self-management, participation, and choice, advance research and understanding of lung disease, or increase EU healthcare competitiveness, or maybe something else, other. Go ahead and put your answers in there. I'll give you guys about 15 seconds to answer that. And this will really give us an idea of what all of you in the audience think is the most important objective as we go forward here. Okay, let's go ahead and close that panel. And if we can display the poll results, please. All right. So we have a just plurality rather of you saying that your most important objective is advanced prevention and public health, 27%. No, actually the highest is improve patients' control over disease, self-management, participation, and choice at 28%, improve care came in at 26, advanced prevention and public health came in at 27. So I think we can really see that those three are roughly equal in terms of the importance that you all are giving them. And the smallest one was increase EU healthcare and competitiveness. That very few of you think is the most important aspect. So that's very interesting to know as we go forward into the panel discussion, which we'll start now. So I'd like to introduce our first speaker on the panel now. This panel, I think it's really representative of the diversity of opinions and experts and organizations that we have on this topic. So I'm really looking forward to hearing from them. We're going to start with Ornella Martinello, who is Policy Coordinator on COVID-19 Response and Health Policy at the European Commission Secretariat General. Thank you, Ornella, so much for being with us here at these very busy times for the Commission. Tell us, what do you think when we're looking at the potential of EHDS to improve lung health, both prevention and care? Is this a dream we're talking about, or can it really become reality?
Thank you very much, Dave, and allow me to take a few moments to thank MEP Serdash and Pizarro for inviting me and to the whole lung health group, because I really think this is a vital forum to discuss lung health in Europe and the links with the European health data space. To reply to your question, I think there is the strong commitment on the side of the European Commission to make the European health data space a reality. Let's not forget that partly he already is, because with My Health at EU, we have already 10 member states which are connected and exchange some types of health data for primary use. But what's important to remark, as MEP Serdash was reminding us all, it's the political momentum in which we find ourselves. This is due to the COVID-19 and how it showed the potential of digital health. But it's a political momentum that is shared by the Commission, by the European Parliament, by the Council. We know that the French presidency has made digital health and the European health data space as a priority for the 6 months presidency. And from the numbers that we see here today, I mean, stakeholders are really looking forward to our proposal that will come in April. And as we know, citizens are really ready to embrace the challenge of the European health data space. To make this a reality, we have to take a first step. And for us, this first step is to have a regulatory and governance framework that has the purpose of creating trust in the system. I think as citizens are ready to share their health data, but they need insurance. And this is what we're trying to do on our side. But allow me also to keep the other part of the question and keep this dream with us, because I think it's really important when we talk about the European health data space to have a vision that really can push us to remain ambitious when we will work together in really establishing the European health data space. And this vision is a vision of bigger wider access and reuse of health data to enable people, communities, and companies to benefit from the potential of health data, regardless of its location. And this is especially important for lung diseases, as the MEP was reminding us, to reduce the burden on the healthcare systems. But what's important also to remember is that access to health data is not an end in itself. We have to strive to establish the European health data space to facilitate care, to make it accessible wherever we are, whether we are in a city or in a remote area, to empower citizens to be able to manage their health, to achieve better prevention, better diagnosis, better treatment, more innovative researches that then feed into better policies. So in a way, this dream, this vision is really to improve the quality of life of Europeans. So I think the two are equally important.
Great, thanks very much. It's really useful to have the insight of the Commission there, I think, and we'll delve more into those topics as we go forward with the conversation. Let me next introduce our next panelist, Arzu Yorgansilo, Advocacy Council Chair at the European Respiratory Society, which has been a core part of the development of the policy brief being released today. She's also a professor at the Department of Pulmonology at Seylar Bayar University in Turkey. So Arzu, let me get your take on this. Do you think that this vision is a dream or can it become reality?
Thank you. Thank you, Dave, for this very interesting question. First of all, on behalf of European Respiratory Society, I would like to express our greetings for this meeting. And I believe that this meeting today will mark the launch of an important document, as you have mentioned, the European Lung Health Group Policy Brief on the future of European health data space. As you also mentioned, the European Commission will be presenting its proposal for the European health data space, and that will bring us a common framework for sharing and exchanging quality health data, such as electronic health records. We, as the lung community, very much hope to benefit from the digitalization of healthcare services. And in Europe, we know that we have vast amounts of data that can improve citizens' health. And we can see in the pool that the first option was to improve patients' control. So this is very much in favor of our thought. But we know that there are different pockets of data are not accessible to the issues in the data transparency, interoperability, uncertainty in countries. And I also experienced this in my own clinic. I do not believe it's not a dream. It is in our hands to make it reality. So we as ERS and European Lung Health Group believe that European Parliament MEP Lung Health Group will be dealing with this dream to come true. Thank you.
Thank you so much. Very inspiring words. And we also really appreciate you being here, knowing that people in the healthcare space are very busy, just like people in the policymaking space in healthcare. Our next panelist is Armando Ruiz, board member at the European Federation of Allergy and Airways Diseases Patients Associations, an umbrella group of patient associations around Europe dealing with allergy, asthma, and pulmonary disease patients. He also leads the Spanish Federation of Allergy and Airways Diseases Patients Associations. Thank you so much for being with us and bringing your knowledge and expertise in digital health. What do you think? Is this a dream or can it become reality?
Thank you, Dave. I'm really very happy to join you in this session. Patients organizations and advocates have great expectations, as we think really that the European health data space can really transform the healthcare ecosystems and our lives, especially after the COVID-19 pandemic. What the EU is trying to do with the digitalization in healthcare is really important. And I can see that there are three big areas to work on. The first one is that digital solutions are designed without involving patients in the development. So everybody is really talking about patient-centric solutions, but this is not the reality. The co-creation of the new solutions is the only way to be sure that we build tools that solve real patients' unmet needs. And with this European health data space, patients should be at the center with a role, because patients are the real new stakeholder in the space. The second area is to build real connectivity and interoperability between healthcare systems, first at national level and then across Europe. This is a real big problem for respiratory patients, as the reality is that we cannot currently travel with our health data, and we cannot share it with the doctors of our choice. And now, maybe the most important area is how much open are we to share our health data? As a patient representative, I can tell you that the key to success of the European health data space is to build trust in digital health, because without trust, we will not have consent. Without consent, we will not have data. So patients need to be crystal clear what is the value of sharing their data and how this can help other patients. The trust and transparency should be the ambition, in my opinion, of the health data space.
Thanks very much. Now let's move on to our next panelist, Sarah Cullen, co-chair of the Task Force on Health Data at the Biomed Alliance, an initiative of leading European medical societies. She's also a stakeholder in the Joint Action Towards the European Health Data Space, which helps EU member states and the Commission promote the secondary use of health data. So she's very much immersed in these issues and well-placed to answer this question. So Sarah, how do you see prevention and care
the vision of the health
data
space?
Thank you very much. Just to give a bit of context, at the European Association of Urology, who I work for, we began looking at the issues relating to use of real-world evidence and big data. It was triggered from our own organisation when we do an annual review of our clinical practice guidelines that go out to our members, our healthcare practitioners, to guide them in their treatment of urological conditions. And actually, a few years ago, we noticed that there are huge evidence gaps in terms of the knowledge that's available, the evidence that's available, but also that sometimes the evidence that is available was not sort of really fit for purpose or not of sufficient quality to be able to guide our decision making. So that's something that triggered us as an organisation on the journey of understanding how we can best use data, best use those secondary purposes to understand the conditions that we're dealing with better, and also to guide the clinicians who are our members on the most up-to-date science. And we can see we've received some EU funds through the Innovative Medicines Initiative to conduct a project on the use of big data for prostate cancer, and we can see that those lessons that we're learning in our small project are also being mirrored and echoed. Their challenges that the European health data space is having to grapple with and address. So there are issues that other colleagues have already mentioned: the interoperability, the standards that need to be set, and the actual infrastructure that needs to back this all up. But one issue that I think we've looked at, particularly with colleagues in the Biomed Alliance, is the issue of governance, and that's been mentioned by other speakers as well. So governance being the real vision behind data sharing. You know, what is responsible, ethical sharing of data, and particularly for these secondary purposes, so for research purposes. And it would be a real enabler, in our view, to have a really clear vision and some legal clarity on what it means, considering all the different pieces of EU legislation and national interpretation of those legislation, what it means to share data safely, ethically, legally for health research purposes. Thank you.
Thanks very much. Now let me introduce our next panelist, Marc Lange, Secretary General of the European Health Telematics Association, a collaborative platform for decision makers and implementers supporting the transformation of the health and care practice in Europe through digital health. Mr. Lange, you have 20 years of experience in the digital health field, so you're really well placed to answer this. What do you think? Is this vision a dream, or can it be reality?
Thank you, and I'm very happy to thank you, David. I'm very happy to be here with you. indeed 20 years of experience, so we have been able to observe all the mistakes that we all have done with digital transformation. But we are progressing, and it's clear to us that the open health data space, it has been a dream, and it is becoming a reality. It has been a dream. Why? Because we have to understand that reusing data, we are producing a lot of data, but reusing data is one of the main objectives, one of the main benefits that we will get, and that our European health and care systems will get from the digital transformation. So that's why it is a dream. Now, is this a dream becoming a reality? It is becoming a reality. The concept for data sharing are very clear now. The resources and even the competence, the skills that are needed are there. We have heard that the legal framework and the governance framework is in preparation. So that's things are, the planet starts to be aligned. But it's clear, however, that there's still a long way to go for the implementation. Why? Because data need to be cleaned, they need to be prepared, they need to be organized, and once done, they need to be analyzed in order to create knowledge and information. So all these are still to be done, and that's key challenges for clinicians, key challenges for the IT industry, and key challenges for data analysts. But this is happening. This is a work in progress. And I think that there's another element that is very important, echoing a bit the point about citizen centricity. There's another element that is very important to keep in mind or to consider, is the fact that this is about, we are about reusing data from individuals, from patients, from citizens, but in fact, citizens and patients can do more than simply authorizing the data to be shared or to be used and reused. They can also become an actor in collecting the data, an actor in sharing the data. And that's a key, an essential element from an ETL point of view. That's really an important element that needs to be further developed. And this will, in our view, contribute also to make the data, the European health data space happening in an inclusive way. Thank you.
Thanks very much. And finally, our last panelist, last but not least, is Bryce Van Eyck, co-founder and managing director of Communicare Solutions, a Belgian startup developing software solutions to empower patients. He's also part of the Dragon Project, which is an EU-funded initiative aimed at increasing the response capacity of healthcare systems in current and future pandemics. Very timely. So Bryce, you've been a pioneer in bringing innovative medicine initiatives forward. Do you think this is all a dream, or can it become reality?
Thank you very much, David, and thank you very much for this invitation. I'm really glad to be here today. As has been mentioned by MEP Sterda at the beginning of this event, there are already many innovations, and current evidence actually shows that through the proper use of digital tools, such as, for example, care companions and AI-based decision support system, and we are active in the development of those types of tools. And I was really happy to see during the poll that the first concern was about giving control to patients over their disease, because that's really what we are developing at Communicare Solution and within the Dragon Project. We can actually achieve better lung health prevention and care if those tools are developed in a sustained contact with their users. That's definitely key. Within the Dragon Project, we've been able to be in contact directly with patients through the European Lung Foundation, for example, which enable to develop tools that will be used by patients because they were part of the development, of course. However, these innovations are still hindered by indeed sometimes scattered and vague legislations about the usage of this data. And we've already mentioned that quite a lot today, I think, but it's really key. Because today we produce a multitude of health data, and that's not the problem anymore. And there is no problem with the willingness to share this data, because there are transparent ways to do that and secure ways to do that. It's more a question of now being able to invest and incentivize the use of systems that can actually benefit patients and society. And secondly, to really clarify the regulatory framework, and to facilitate the responsible usage of this health data. So really my hope today, and I'm really happy to see the energy and the willingness that is behind this European health data space, is really to help to overcome those barriers and enable Europe to continue to be a driving force in healthcare innovation, and to focus on increasing quality of life of patients in Europe.
Thanks. That's really interesting to hear that kind of on-the-ground experience, particularly with the applications that we're going to be talking about here. So now I have more questions for the panelists. And just a reminder for you at home, you can ask your questions to the panelists by just pressing the Q&A button at the bottom right of your screen. Type in your question and I will read your question out to the panelists. But first, I have a question for Arzu Jorgensilu. So Arzu, the digital health technology outcomes that we're talking about here, when we're talking about the technology, the possibilities for the technology to serve respiratory disease outcomes, do you think that this represents a minor change, or is it something that would really be a complete change in paradigm for how we're thinking about these things?
Yeah, I think that it will be a great change that will change the paradigm. And I would like to give you an example for this. We as the respiratory community had a very unique experience, not a good experience in COVID-19 pandemic, but this respiratory disease has broken the mold. During the pandemic, we have seen that the barriers can be overcome, and also digital solutions can be found when there is a will. So as an example, the opening of the European Reference Networks platform to COVID-19 exchange and the very fast adaptation of the EU digital COVID certificate are very good examples for this. So we believe that this momentum can be extended to the other disease areas, other non-communicable diseases. So we like the Commission's target that by 2025, all citizens should be able to share their health data with the healthcare provider of their choice when they are traveling abroad in the EU. But we suggest an additional target that by 2030, health researchers also have sufficient access to the controlled data spaces to improve citizens' health and to ensure medical research can continue to thrive in Europe.
Armando Ruiz, let me put the same question to you. Is this digital health technology revolution we're talking about, is it a revolution? Is it a paradigm change?
Yeah, of course, it's a revolution. I mean, big data and machine learning are really a reality in many clinical situations. Thanks to COVID also, we see really one acceleration in the digital transformation and also a growing uptake from doctors and patients. So that is the reason I'm saying that really we are in a new paradigm. This said, data and digital solutions to support clinical practice should be life-saving and life-changing. For example, algorithms can support doctors and reduce the high number of misdiagnoses that we have today. Think that 1 in 6 asthma and COPD patients get a wrong first diagnosis. And for example, do you know that healthcare represents only 10% of what influence health? With this, I mean about what the system offers to patients, the treatments, chronic care, because behavioral change and behavioral patterns represents 40%, and the social circumstances represent 15%. Then we have the genetic predisposition and environment, but I see clear that digital health solutions can impact on the behavioral change and the social aspects. And this is a big opportunity to build an effective European health data space. I want to share only with you 2 topics where we see the future of the space. One is the empowerment of patients. We need to give more co-decisions about their health, improving self-management, giving access to healthcare data, and very important for us, investing in digital literacy. And another one is about supporting scientific research for the benefit of patients, working on this personalized medicine. And because of this revolution, we are sure that we will have a better quality of life of our patients, our respiratory patients. Yeah.
Thanks a lot. Marc Lange, let me put the same question to you. Are we talking about a total paradigm shift here or something that's more step-by-step?
It's a total paradigm shift, of course. Why? At least two elements that I would like to highlight here. First of all, this is, and I think that Armando made it also clear, this is the enabling the emergence of new models of care, which are better combining caring and preventing. So that's, and even caring and preventing, and today, virtually and in presence. So this hybrid model of care. So this is new model of care that are emerging. That's the first reason why that I would like to highlight. But the second reason is the fact that because of all the availability of the data and because of the possibility to analyze the data and to exploit the data, much more can be done on prevention. But the trouble here, or the challenge here, is the fact that then we need to move the budget, or we need to increase, first of all, the budget on prevention in the healthcare systems in order to be able to exploit the data and to make them delivering benefits. And of course, that means that at a certain moment, there will be a need to shift or to lower the data, the budget on the care side of things in order to increase the budget on prevention. And that's really a very, very big challenge for the politicians to be able to manage that transformation. So that's paradigm shift. Thank you.
Yeah, for sure. That's a big, big challenge for the politicians at EU level, at national level, and of course, striking the balance that we're talking about here. I want to ask you guys about the role of patients, really putting patients at the center of these changes. So Ornella Martinello, when we're looking at digitalization, enabling self-management for patients, right? Really empowering patients to take care of their own healthcare. What is the role of patients there? What do patients have to do as part of this equation, and what kind of benefits can they expect?
Well, I think actually the participation of citizens in the management of their health will be a strong element in that change of paradigm the other speakers were talking about. It will really characterize the evolution of the way we provide the healthcare and we manage it in the future. And what's important here to say is that we at the Commission, when preparing the proposal for the European Health Data Space, we are aware of this, and we really see that the patients should have a central role in this architecture. And so our aim with the proposal will be to empower them, so to strengthen those rights that they already enjoy, so the right to control their health data and the right to port their health data. But we really want to make this more practical and stronger. And for this, it's important, as I was saying before, really, I want to insist on the need to build the trust in the system that can empower citizens and trigger their participation in the system. So this is one element. We can put them at the center, but if it's not there's no trust, then the system will not work. And the other element, which I think needs to be underlined, to be meaningful, this participation, we need to provide citizens with the tools to understand their role and to participate. So we really see that one of the pillars of the European Health Data Space is digital literacy of patients, of citizens, but also of healthcare providers and all the actors that will play a role in the system. So we're looking into these, and of course, digital literacy means an effort of the whole community, but it also means money. So we have this on our radar, and we're really looking into this.
Thanks. Bryce Van Eyck, let me put the same question to you. What is the role of patients here? What responsibilities will they have, and what benefits can they expect?
Well, really for patients, having the opportunity today, we talked about a lot about literacy of patients, which is something we really focus on during the Dragon project, but also within the tools that we develop in general for chronic conditions. That's the first element, I think, is being able to understand what is happening to me, what I can do to make things better, and what I should look for. Today, we have access to a multitude of information, but it's difficult to know exactly what is relevant to me. And through these tools, we can actually deliver information that is relevant to these patients and put them into another communication mode with their healthcare providers. I think one of the great outcomes of this is that the ultimate aim is for patients to be able, of course, to measure outcomes, to get predictions, to be able to act actually as a patient, but also to create more time for meaningful connections with their doctor, meaning that a lot of time that is spent between the patient and the doctor on general information and miscommunication could actually be used for meaningful interactions. And that's the whole aim of what we want to do. We talked about trust, of course. I definitely believe that it's important for patients to trust in those systems before they will actually use them. But there are systems in place within the Dragon project. I want to mention we are developing a distributed learning network between hospitals, which would enable to develop AI tools based on data from patients, but which are pseudonymized, which are not traceable to the patient, and which are interoperable with each other, meaning that we can use data coming from different hospitals in different countries in Europe in an easy and efficient way, because that's also important. As we talked about healthcare costs, we need to make this whole system cost efficient as well.
Sarah, Cullen, you've been working very closely with these health data space issues. So what do you think is the right role for the patient in all of this?
Well, perhaps to come back to my earlier point around governance and the vision that this European health data space legislation has for using data to both in direct care and for secondary purposes. And I think there is a real role at a governance level for patients and for citizens. In the Biomed Alliance recommendations, we suggest perhaps the creation of a European level kind of advisory data ethics advisory board that should involve, for example, patient representatives and lay people to discuss and really have a grapple with some of these sometimes quite deep ethical, legal challenges that will be faced, and that could be a mechanism, a stewardship mechanism that could be put in place to deal with that. Currently, the landscape is quite patchy across Europe. We have ethics committees that are mandated through clinical trials regulations, and quite often my colleagues will have to, whatever research they conduct, they have to get ethics approval. But when you take into account GDPR, for example, you should really be going through a supervisory authority, a data protection supervisory authority. And there's, then if you get the governance right, if the EHDS can get it right, you can make those connections. And actually, across the board, you need to include for feedback from lay people, from citizens, and from patients about what their priorities are and what might be the best way forward in terms of European health data space and the challenges that will have to be faced.
Armando Ruiz, I want to ask you about this as well. Where do you see the role of the patients in all of this?
Well, I mean, everybody knows that self-management is a key point for chronic conditions. This is a challenge for the patients. In my opinion, digital therapeutics are the most solutions with the highest potential to implement technology and the use of data in the disease management. This DTX, that is the abbreviation of digital therapeutics, really are evidence-based therapeutical interventions that can prevent or manage or treat a medical disorder or a disease. Germany, for example, is the first country in Europe that started a reimbursement pathway for this kind of products. And I see this a big opportunity to work together, patients and doctors and providers, to show impact in the self-management. In this new paradigm can help us to develop these new technologies and use the data to engage patients and their responsibilities. Asthma and COPD patients have adherence rates to treatment around 50%, and behavioral change is a challenge for them. And I think that digital solutions is a big opportunity. Really, from IFA, we hope that this new European health data space can help us to have a happier life.
Thanks. Yeah, sounds very promising. Let's go to the audience. We've had some great questions come in from you guys from the audience. Thank you so much for those. Let's take the first question here from Peggy McGuire, who's from the European Institute of Women's Health. She asks, is there an opportunity for the IHI, that's the Innovative Health Initiative, the framework that replaces the IMI, the Innovative Medicines Initiative? Is there an opportunity for the IHI to build a community around digitalization and respiratory disease with patients at the center? Ornella Martinello, let me put that question to you. Do you see that opportunity?
I will give a very straight answer, and I think the answer is yes. I think it's important, as we were saying, to connect communities and give them a role. And in the case of respiratory disease, but also in other sectors and areas and dimensions, I think this can certainly lead to progress and innovation, more importantly.
Great. Would anyone else want to come in on that? Just raise your hand. I can see you on the gallery view. Okay, no. I'm going to move on to the next question. The next question comes from Shane Fitch. So Shane asks, do you believe that the establishment of leading partnerships from all stakeholders, public, private, not-for-profit, with patient organizations, is key to more successful confidence in driving data sharing? Who would like to take that? You can just raise your hand in the screen. Panelists who would like to. Arzu, okay, great.
I believe this is a very important question, and I also believe that will happen, that communication and the collaboration between the stakeholders are very important. And I must say that lung disease patients, as well as the healthcare professionals, are very eager to participate in the future European health data space.
Thanks. Bryce, I'd be curious to get your take on this as well, about these partnerships. I mean, would that be useful in the kind of work you're doing?
Yeah, absolutely. I mean, those partnerships are part of what we do, for example, as a company indeed, but also within the Dragon project, where we have a lot of stakeholders. We have universities, we have hospitals, we have patient organizations and healthcare providers, representatives. But indeed, I think as we are still in a phase where we need to get those tools to the market, there is need for a strong collaboration between those different actors. And that's the reason why, for example, we are in constant discussion with both patients and doctors during the whole development process. Because in one of your questions in the beginning, you mentioned indeed, is it a big change or is it some steps that we are making? I think we're also making steps during the last few years because people cannot jump right away into a whole new world. So that's why I think it's extremely important.
Yeah, makes sense. Marc Lange, you wanted to come in on this as well?
Yes, indeed. Simply to say that for ETEL since the beginning, digital transformation will not happen without having everyone around the same table. That will not happen without them, meaning that patient, industry, health insurers, clinicians, policymakers, regulatory organizations, innovation agencies, they all need to be there. And this is happening today, meaning that this is already the case. The whole civic society is already very active in the field, doing a lot of noise, doing a lot of information sharing, and that's already illustrating what is happening for the moment. And that is, it's indispensable.
So we have a next question coming in from Eric Van Gans. He's from Respiratory Med in Lyon, France. So Eric says, as emphasized by Bryce, a key issue is health literacy, dramatically under-recognized and under-investigated in Europe. Would the panel be able to recommend EU initiatives in that regard to assess the levels of health literacy in respiratory conditions and to develop interventions? Maybe let's have, who'd like to take that? Would like to raise your hand? Ornella, I think you'd be well placed to talk about EU initiatives, right? Ornella?
I'm not sure I would. I don't know what I can share here, but I mean, I can say that when I talked about digital literacy, in this case, it's not just digital; it's also digital health literacy. So of course, this is something we need to look at together with the digital. It's not just the way I access or I use the app to look at my health data, but it's also what I see, what I read in the health data that I have access to. So of course, this is on our radar too, but on concrete initiatives, I'm not sure how much I can disclose.
Well, Bryce, you raised your hand for this as well. What would you say?
I don't have a concrete initiative to mention, unfortunately. But what I just want to add is that from our experience, indeed, patients that don't have any digital literacy have big difficulties using these tools, but they can be made easy to use enough to actually include a vast majority of users. And what we see, for example, with the testing that we made with patients, for example, in COPD, is that there is no wariness of the use of the tool, which is a really, really good sign, meaning that people continue to use it. And I just want to add also regarding health literacy as well. I think the question was raised from someone in France, where there is a system of reimbursement also for the monitoring of patients, for example, with COPD. And one of the key components of this regulation is that there is a need for health literacy to be put in place for the patients, either physically or virtually through a tool.
Good, some good practical information there. Marc Lange, you wanted to come in on this as well? Yes,
indeed, because I would like here to put on the spotlight the keynote speaker of the symposium that you organized last December from Kat Macaulay from Scotland, where in Scotland they really quickly now already develop a policy where they identified a large number of the population which is not digitally connected, and they financed not less than 500,000 tablets with internet connection of data with data connection for the people who were considered as being identified as being excluded from the digital world. All this in the context of healthcare and hybrid model of care, and all this in the context of making them available to enabling them to have access to healthcare and to digital health systems. So that's something that is worthwhile to be mentioned.
Thanks. So you mentioned that access to digital tools, access to digital information. It's related to a question that came in on the chat. Okay, so this was from Jill Fairweather, who said she's co-founder of aspergillosis or trust a rare disease. We have patients with all levels of education, and many find dealing with technology quite worrying. And these plans could leave so many behind. Armando Ruiz, maybe you could take that. Is there a worry that too many digital, if we rely too much on digital tools, it could leave some people behind who are not as digitally savvy or maybe not able to access it?
Yeah, of course, we have a gap using technology, and not just in healthcare, in general. We need to think how we solve this gap, but we have another problem that we didn't solve: the health literacy in the population, and we need to move to the digital health literacy. That is totally different because it's moving so fast. What we should train today is changing in 2 years or 3 years. So this is a big challenge to involve the patients or people, but this one of our priorities to be sure that everybody can access and the equity of the healthcare systems to the people, to the society. Yeah.
Yeah, that makes sense. Sarah Cullen, here's a good question. Oh wait, Arzu, you wanted to come in on this question?
Yeah, I just want to comment that in this policy briefing of us, we also defined it that for this digital spaces for lung health that are patient and the healthcare professionals and affordable. So this can be achieved by improving the population's digital literacy so that they can access secured health data. This is a comment from my side.
Thanks. So Sarah Cullen,
if I may, just one thing, using the example of the EU digital COVID certificate. Of course, we have to invest in digital literacy, but this takes time. In the meantime, it's important that we don't leave anybody behind. And the example of the COVID certificate is a good one because we managed to make it accessible to everybody. It's mainly a digital tool, but it also has an offline and paper version that allows to have everybody on board. And I think this is the transition to get to a full extent of digital literacy in our societies.
I think that's a really good point because, of course, on one hand, the opportunity to use a paper certificate was available, but I know anecdotally I've seen even very elderly people, no problem using the smartphone version with the QR code. And I've been really surprised sometimes seeing how easy and seamless it's been. Armando, you wanted to come in on this also?
Yeah, I just want to add something, one example that is interesting, I think, here for this discussion, that people have been using the technology so well with the certificate of COVID. But now, if I'm moving from Barcelona, where I'm living, to Madrid, for example, the healthcare systems in Madrid, they don't know if I got the vaccine or not. The systems are not connected. So we are pushing the people to use the technology, but then the systems is not giving the work done because people have the certificate, the COVID, and then we are moving around the country and the healthcare system, they cannot access to the information that I have here in the region where I am living. So this is important to give trust and to show the people that they are doing well the homework, but the system have to do the same.
Great. So Sarah Cullen is the question for you from the audience. It's from Paul McGinnis. What do you think is the role of artificial intelligence in risk stratifying patients with an existing lung disease condition?
For the AI as a tool, and something that I think we're already seeing the results of it for different conditions, and even for example, lung cancer as well. And I think it's really important to remember that these are tools, right? They're really fancy tools, but they are tools, and at the basis that these AI tools are driven by data, and that, and it's really important to remember when we talk about bias or inequalities that it's also they're going to be driven by the data sets that they're fed with. So all of this work that what we've just been talking about in terms of the European health data space, being able to bring on board like these very diverse data sets, bring up the data quality standards. It's a really, really important endeavor, because the more, you know, the more quality data that you can onboard into a system, I guess it becomes, you know, we've got a great diversity within EU member states, and the more that we can get everybody on the same page in terms of sharing data, or at least in terms of making sure that that data is interoperable, you know, then you're really getting to the heart of using some really quality tools to be able to guide, like, clinical decisions, for example. We're involved in a project, IMI, a funded project with the European Respiratory Society, the European Lung Foundation, which is looking at using AI, so as a tool to guide decision-making, clinical decision-making on the treatment of 3 main cancer tumors: lung, prostate cancer, and breast cancer. So really, you know, exciting initiative that hopefully it's just started, but hopefully in the next sort of coming years that we should be able to see that those kind of insights working their way into clinical practice.
Great, thanks. So our next question is for Bryce. It is from Vitaly Mishlenov. To Bryce, who will be responsible for data input, the patient or a physician? Is it an additional duty for every doctor?
So in terms, I can only speak, of course, for what we are doing. Of course, in terms of data input, the tools that we are developing are really aimed first at patients. So it's all about self-management. So they use the tool to measure outcomes, to learn more about their disease, about their treatment options. And I think it's very important to have clarity about what the tool is aimed for. So in our case, for example, if the patient is feeling really unwell, we still tell him in the beginning of the use of the tool that he should go to the hospital. The tool is not there to suppress the need to know what is happening to you and to act on it. It's just there to support both the doctor and the patient to have a history of measurements, for example, and to add alerts system. I think that the work done on the European health data space, its legislative part could also help on that, to try to clarify some of those responsibilities as well.
Great, thanks. Well, we're just about out of time for the panel, but before we go to the closing remarks, I do want to put, there was an interesting comment that came into the chat from Hilda de Kaiser, Ornella, I want to see, just get an impression from the Commission's perspective, if you agree with Hilda here. So Hilda said, I think it's crucial that the patients have a crucial central role in this. It is important that they can also share the data and which are important to them next to the clinical data, which is collected in the clinics. This way we can make sure their needs are at the center of their healthcare. Ornella, would you agree with that?
I certainly agree, and I can say to connect to what Bryce was saying, that of course data will be inputted by professionals, but I don't see why citizens, patients couldn't also input their data. I think about mobile wellness application that in a way can support also this holistic and multidimensional approach to the healthcare and to the health management of a patient or a citizen. So I certainly agree with this comment.
Okay, that's good to hear. So thank you to all the panelists for some great insights there. I mean, I think we've heard in particular that it's really crucial to get the patients central here, and that patients will have some new responsibilities, but they'll also have new benefits for all of these new tools. We've also heard ways that we can make sure that certain patients aren't out of the loop when it comes to digital tools, that when we're developing these tools in the EU, that we can really think about what is the best for all patients, not just a certain category of patients, not just the most tech-savvy patients, but how all patients can really benefit from this. So thank you to the panelists for some great insights there. I'd like to move on now to our closing remarks. And for that, I will introduce center-left Portuguese MEP Manuel Pizarro, who is also a practicing Portuguese physician and is also a member of the MEP Lung Health Group. MEP Pizarro?
Yeah, thank you. Thank you very much, David. It was a very, very interesting meeting. And I think that the first conclusion that we can draw is that it is clear that lung disease patients and healthcare professionals are eager to participate in the future European health data space. And of course, as a lot of people state in the meeting and even in the room, they must be involved in creation of an effective European data space. There are two clear roles for them. Firstly, as active digital health data providers and collectors. Both patients and professionals must have sufficient education and training to be active providers and active collectors. Secondly, perhaps even more important, they can be the primary beneficiaries of health data systems around them. These roles will ensure that the digital health space will facilitate care, transparency, and participation while enabling effective research and increasing access. Such vision will require sufficient investment from member states and from EU programs, such as EU for Health, Innovative Medicines Initiative, and the Digital Europe program. We also need, and I think it's very important, a strong regulation with mandatory standards for interoperability at the EU level. This could be done through the EU regulatory body. For example, disease registries, such as on asthma or other diseases, need binding interoperable standards to foster research and to be really useful for patients and medical professionals. In order for the new legislation to be effective, it will require significant funding to establish the infrastructures that will be needed. In short, the more binding and mandatory common rules we have on health data, the more progress we will make for citizens and patients. I will work, of course, with the European Parliament to ensure Council and Commission commit to significant funding and also to establish the rules, clear rules of the data space to create a meaningful health data space. I think that the large participation in this meeting shows that we, from the side of the patients and these organizations and from the side of the health professionals, we are prepared. It's necessary that the European institutions give the answer that we are needing now. Thank you very much.
Thank you very much, MEP Pizarro. Yes, I think for sure we can see from the registrations, from all of the questions we've received, which we weren't able to get to all of them, that there is a keen interest in this topic. After all, this is a topic that's going to affect all of our lives. We all have healthcare. We all use digital services, and this is something that's going to matter a lot to a lot of citizens. So thank you all so much for spending your afternoon with us and talking about these issues. Now, as we're waiting for the Commission proposal, you guys will be able to not just sit still and wait. You can, of course, go back and watch the video of today's session that will be available on the website. You could, I think it's come up on screen now. And then also you'll be able to read the report online. So the link for the policy brief is now in the chat. If you scroll up, I think Isabel has put it there into the chat. It's the same name. If you just want to Google it, it's the same name as the name of the webinar, Improving Lung Health Through the Future European Health Data Space. And if you've got something to say on this topic, you should say it to the world. Put it on social media. You can use the hashtag #BreatheVision or the hashtag of the MEP Lung group, which is hashtag MEP Lung. So thank you again to the speakers and to the audience for a great discussion. And I wish you all a wonderful rest of your day.